Today's video topic is what to expect after a liver transplant. A liver transplant is a medical procedure that replaces a damaged liver with a healthy one. The healthier liver comes from a donor, who may be a stranger, someone you know, or someone who has recently passed away. The transplant might be one of the entire liver or just a portion of it. The latter works because the liver has an innate ability to develop into its regular size. Although you may have a new liver, that doesn't mean that you will feel comfortable immediately. Recovery from a liver transplant occurs over a lengthy period and in different stages. To better understand that, here's what you should expect after a liver transplant. Initial discomfort. You will start to feel uncomfortable immediately after the surgery, with some soreness in the belly or your side. The soreness will last for a week or two, during which you may also feel numb around the incision area. Furthermore, you will also feel tired as your body focuses on adjusting to the new liver and developing it if it's a portion. Your energy may not fully return for 2 to 4 months. During this time, you will have to strictly follow the medication prescribed by your doctor. This includes the anti-rejection medication, which is a must if you don't want your body to reject the new liver. Furthermore, the medication could also have certain side effects, with the body becoming more susceptible to infections in many cases. To counter this, you will have to avoid going to places with a lot of people and have to stay away from anyone who's sick. Moreover, it can be an emotionally distressing time. It's important to have people around you to rely on and a healthy support network. Caring for yourself at home. Taking care of yourself after a liver transplant takes time and effort. You will have to be diligent with 1. Your activity. Recovery requires a lot of rest, and you can't go back to your daily routine immediately. You have to take the time to regain strength and ease back into regular life. 2. Your diet. Your doctor will recommend a diet that focuses on helping you recover and strengthen the immune system. You must follow the diet plan religiously. 3. Your medication. Similar to the diet, you will have to follow your doctor's advice and take your medication as they suggest. 4. Your incision care. The bandages around the incision will have to be changed regularly. Make sure not to skip out on any doctor's appointments for this and keep the bandages dry.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.